10. BBS Regional Group Ireland, Information Day, May 2023. The first All-Ireland BBS Information Day was held in Antrim, Northern Ireland, on the 13th of May 2023. People with BBS, family and friends travelled from all over Ireland to attend, as well as Team BBS UK and professionals from the BBS clinics. It was a great day for collaboration, camaraderie and good fun, with a quiz and charity draw being held in the evening. Laura Dowswell, Chair of BBS UK, welcomed everyone and introduced the speakers. Professor Phil Beals, who has dedicated 30 years to working with and researching BBS, gave an overview of BBS, the research around the syndrome and the BBS clinics, which are NHS funded, highly specialised and offer a multidisciplinary approach to BBS. Some of the main points were: A. Each clinic provides access to specialists in areas covering ophthalmology, nephrology, dietitians, clinical psychologist, geneticist, speech and language, and endocrinology, as well as telemedicine clinics for those who cannot attend in person. B. There are currently around 650 patients on the clinic's database, with 250 patients attending face-to-face and 92 patients attending remotely annually. C. BBS 1 and BBS 10 are the most prevalent variants, accounting for approximately 70% of all cases. D. NHS BBS Patient Registry maintains a database of BBS patients which is primarily used for tracking purposes and for identifying potential candidates for clinical trials. And E. There have been 1,428 BBS-related research publications to date, the majority of which have been written since the year 2000. Katie Megahay gave her personal perspective, where she spoke of her life for over the last 40 years, her difficulties with weight and how she worked to overcome them with the assistance and advice from a dietitian. Katie was diagnosed at the age of 6 with BBS and is now registered as blind. Katie loves concerts, day trips and shopping. She has competed in various events and is very active. She has travelled a lot with her family, went to a performing arts school, is part of a choir and is training in Marie Curie therapies. Her third guide dog is currently in training. Charlene Ferguson, Family Support Officer with the Royal National Institute of Blind People, RNIB, in Belfast, spoke about the government-funded services they provide to parents and families from early years right throughout adulthood. A. 6-week information sessions. B. Shape and share events which bring children, young people and their families together with no cost attached, for peer support, to share experiences and take part in fun activities both in person, across the UK and online. C. Family information days, events and education support. And D. Therapies for children such as swimming, massage and many others. Sandy Woods gave her personal perspective on being a parent to Charlie, aged 4, who was diagnosed in 2019 with BBS. During her moving talk, she shared her family's experiences, the highs and lows, and how every day with Charlie is a gift. Sarah Flack, Principal Dietitian with BBS UK, provided thought-provoking facts which pointed out some of the myths about what traditionally would be considered healthy foods, but which are high in calories, so should be limited when following a calorie-controlled diet. She also shared easy wins, which included sleeping well, using smaller plates, and trimming fat off meat. Reno Costanzo, Scientific Affairs Manager for UK and ROI Rhythm Pharmaceuticals, gave a background to Rhythm Pharmaceuticals and a summary of setmelanotide, a drug licensed to treat patient obesity. Reno explained that many BBS patients have an impaired function of the MC4R pathway, which is the key regulator of body weight and hunger. The hormone leptin should signal to the brain when full. However, with a faulty MC4R, this signalling is impaired and the brain doesn't get the message that, I'm full. The setmelanotide drug bypasses this signalling. Rhythm Pharmaceuticals are currently collaborating with BBS UK and BBS patients. Gillian Stafford gave her personal perspective and detailed her struggles in her early years at school and how she was diagnosed with retinitis pigmentosa at 17, as well as her late diagnosis of BBS at 41. It was at college that she found her voice, and how with the assistance from great tutors and her family, she graduated with a master's in social policy. She has since become an Access Ambassador, spoken at numerous events abroad, and is an active member of an independent living movement group. Tonya Heimers, Operations Manager, BBS UK, outlined the history of BBS UK, including its mission and vision, and gave an update on the services provided by the charity. BBS UK has been supporting the establishment of an Ireland subgroup to help create greater awareness, networking and support to help people with BBS and their families and/or carers. In the afternoon, roundtable discussions took place where the attendees were able to ask questions of the expert speakers, which proved to be a great additional source of information. Lots of activities were available for the children, including a pop-up cinema, board games, nail painting, colouring and much more, all of which added to the enjoyment of the day. Lindsay McKnight, founder member of BBS RG Ireland, closed a very successful event by thanking everybody for attending, the exhibitors, the speakers and the UK and Irish BBS groups. She rightly received recognition from the BBS Regional Group Ireland for her enthusiasm and passion in bringing this event together. Feedback. After the event, attendees were asked to rate aspects of the day out of 5 stars, with 5 being the highest rating. Here are the results from those who completed the evaluation questionnaire. A. The information day overall, 5 stars, 100%. B. The morning programme, 5 stars, 88%, 4 stars, 12%. C. The afternoon programme, 5 stars, 82%, 4 stars, 12%, and 3 stars, 6%. D. The children's or young people's activities, 5 stars, 100%. And E. Lunch and general refreshments, 5 stars, 62.5%, 4 stars, 25%, and 3 stars, 12.5%.